Talking about stomach problems, leaky gut in particular, but other problems too can fall under this general topic of digestive disorders. There's not too many things that can cause the problems. You keep them in large groups. As I mentioned in other videos, there's food sensitivities, there's low-grade infections, there's toxins that might accumulate, there's a lack of nutrients. Those are kind of the big four that if you handle those, 95% of the problems solve and clear up and go away. I'm going to just talk for a minute about the types of infections that are the common ones for the stomach that cause leaky gut syndrome, that cause irritable bowel syndrome, and then the symptoms follow from that. There's 4 broad umbrella types of infections. There's viruses, there's bacteria. You hear about bacteria mostly, and that's mostly what people are worried about. Bacteria are the type of infections that usually kill people. So that is correct that people would be more nervous about bacteria because they have a stronger chance for like, oh, he died from a bacterial infection. But there's low-grade bacterial infections too. So viruses, bacteria. The number 3 group is yeasts. I may have heard of candida, various types of yeasts, mold, fungus, those kind of in that umbrella term of yeast. And then number 4 is microparasites. The types that I see in my office, make a guess, I'll give you a second to guess. The 2 types of infections that I see mostly here in the office are microparasites and yeast or fungal infections. I think that I find those more because the medical profession is so good at identifying the first 2, particularly bacterial infections. So people, how do they handle bacterial infections? They take antibiotics, and generally that clears up the bacterial problem. But the interesting thing about yeast and microparasites is, guess what does not kill them? Antibiotics. Antibiotics do not kill them. It has to be a specific type of medicine or herb or oil or something, or just strengthening your immune system that can get rid of these 2. People think, I took antibiotics, and there's some confusion with that term, thinking that's a medicine that kills any infection. It is not. Antibiotics are designed to kill bacteria. So using the term correctly, antibiotics are good for a bacterial infection. If you have a viral infection, you need to handle it differently. If you have a yeast infection, it would need to be handled differently. If you have a parasite infection, it would need to be handled differently. So there's different types of infections. Those infections have certain strengths and weaknesses to them. We try to exploit their weaknesses and try to help, get your body to kill it off and then get back to a normal stomach function. So just talking about the different types of infections, I find yeast and fungal infections very common. I also find microparasites very common. And there's another one you might have heard of, is a type of bacteria called H. pylori that lives in the stomach. It is a mischief maker. It is behind a lot of acid reflux because it can survive the high stomach acid, live in the stomach. And then it causes some dysfunction with the sphincter on top of the stomach that's supposed to contain the acid. If the sphincter becomes dysfunctional, sometimes the acid can leak up and come up into your throat where it's delicate and soft and should not be having acid. So sometimes the H. pylori handles acid reflux. So just wanted to mention that. Those are some of the different infections that I see behind stomach problems of all types. If you have questions, ask me the question. Comment below. If you know someone who's sick or has some stomach problems or anything that they might benefit from these videos, please share with them the video. I look forward to meeting new people, making new friends, and questions and comments welcome. I'll do my best to answer any questions you have or make a video about it. Thanks, guys.